Go.
Hi, I'm Dana Fredricksen, and this is my head-to-toe video assessment for Lindsay Helm at Presentation College. Let's go meet our patient. Knock, you ready for us?
Yep.
Hi, Michelle. I'm Dana. I'm here to do your head-to-toe. Can you give me your full name and date of birth?
MMU 12873.
Okay. All we're going to do is we're just going to start from your head and go down to your toes. I'm just going to do a little bit of palpating, listening to your lungs and your breath sounds and things like that. If you have any questions along the way, please feel free to ask. Do you have any questions before we start?
No.
Okay. First I'm going to start with checking your eyes. Hold that against one of your eyes and read the smallest line that you can read.
374258.
Perfect. And the other eye?
937826.
Okay. And both eyes.
428739.
Okay. Perfect. Thank you. Okay. So all throughout the assessment, I'm going to be looking for any abnormalities in her skin, making sure everything is symmetrical, looking for lesions or bruising, bumps. I'm going to be assessing as I palpate and as I walk through the assessment. So I notice right off the bat her mood is appropriate. I'm watching for her affect. She's smiling and in a appropriate state. She's groomed and she just generally looks clean and appropriate. So I'm going to start by palpating your head. And I'm looking for any lesions or bumps. And do you have any tenderness when I'm doing this?
No.
Okay. All right, I'm going to go down and palpate your ears. Nothing there. Okay. I'm going to palpate your lymph nodes. Any tenderness there?
No.
Alright, I'm going to palpate for your thyroid gland. And if you can just swallow for me. Good. And TMJ, open up your jaw. And close. And open. And close. Does that hurt at all?
Nope.
Okay, and then your temporal arteries. Looks good. Okay, next I'm gonna look in your eyes. What I'm gonna have you do is just look straight ahead, and I'm gonna look for pupil reactivity to the light. So I'm just gonna stay straight ahead. Both pupils are round and reactive to light. They're equal bilaterally. Now I'm gonna have you close one of your eyes or cover one of your eyes, and I want you to tell me as soon as you can see the pen light in your peripheral vision.
Can't see it. No. No.
Okay, perfect. And if you could just follow that pen light. Perfect. Now I am going to, first I just want to look inside your eye. Conjunctiva is pink and moist. Alright, now I'm going to look for red reflex. So if you can just look straight ahead. Okay, now I'm going to work with your ears. So I've already palpated your ears. Everything looks good. Now what I'm going to do is the whisper test. So if you can hold one ear closed, and I'm going to whisper a word into your ear. If you can just repeat it out loud.
Dog. Cat.
Okay, that's good. Next we're going to do the Rhines and Weber's test. So I want you to just tell me if you can hear the vibration in your ear.
Yep.
Okay? And now I'm going to tell me when you can no longer hear the vibration.
No.
Okay, good. I'm just going to other ear here.
Yep.
Okay. And now I'm going to look inside your ear. Okay. Looks good. No issues there. Okay. Okay, next I'm going to have check your nose. So if you can hold one of your nares and sniff, and the other nair, sniff. Okay, and now we're going to do the smell test. So if you can hold one of your nares again, tell me if you can smell the coffee. Okay, and the other. Okay, and now I just have to take a look in your nose with the scope. Okay. Looks good. I'm just going to feel any tenderness or issues there.
No.
Okay. And her nose is midline. Everything looks good. I'm going to palpate for your sinuses. And if you could smile for me and raise your eyebrows. Okay. Now we're just going to look in your mouth. Let's see. So if I can just have you say ah. Okay, and just open your mouth. Perfect. Okay, now we're going to move down to, I'm going to palpate again your lymph nodes and your jugular. That's good. Now I'm going to have you do range of motion on your upper extremities. So if you could lift your shoulders and down, and now resist against my hand and down. Good. Okay, arms out and down, and elbows down, and then wrists, and then left and right, and then your fingers, and then rapidly move between your thumbs. Perfect. So now I'm going to have you resist, push up against my hands and down. Okay, and same with push up against my hands and down. Okay, and then squeeze my fingers. Perfect. Okay, now I'm going to do pulses. We're going to start with your brachial pulse. Good. A radial pulse. And that's good. And now I'm going to do reflexes. Okay, so I'm going to have you start here. Okay, good. There we go. Okay. We're going to come down under your knees. Hold your arms like this. Yep. Okay. Just let your knee hang. Okay. Sorry. Good. All right. Next, I'm going to have you open up your hand and close your eyes and tell me what you feel in your hand. You can
close it.
Yeah.
A coin?
Yep. Okay. And now I'm going to draw a number in your hand, and I want you to tell me what it is.
9.
9. Okay. So keep your eyes closed, and I want you to tell me if you can feel sharp or soft.
Sharp. Soft. Sharp. Soft. Sharp. Soft.
Okay. Tell me if you can feel this vibration.
Yep. Yep.
And here.
Yep. Yep.
Okay, good. Okay, now we're going to move to the back. And so if you can just turn sideways so I can work with the back. First, I'm going to look, and everything looks symmetrical. Her shoulder blades are scapular. Her spine is midline. You can tilt your head forward, Michelle. And the spinous process is midline and looks good. And do you have any tenderness or any issues there?
No.
Okay, I'm looking for any lesions, any bruising, any discoloration in the skin. Everything looks good. So first I'm going to do, I'm going to have you say 99.
99. 99. 99. 99.
Okay, that's good. Now I'm going to listen for some breath sounds. I need you to take a deep breath, and if you get dizzy at any time, just let me know, okay? And deep breath. Deep breath. Deep breath. Okay, good. Whoop. All right, now I'm just gonna percuss. Okay, that looks good. You want to turn back towards me, and we're going to kind of do the same in the front. So we'll have you put your hair back. And I have you say 99.
99, 99, 99, 99.
Okay. And again, everything is symmetrical. I don't see any lesions or bruising. No deformities. I'm going to do some helping. Okay, I'm going to listen for some breath sounds. Okay, breath. All right, now I'm going to listen to your heart. And this is your apical pulse. I'm going to check your heart rate. Okay, good. I'm just going to listen to your heart again with the bell of my stethoscope. Okay, and then I'm going to listen to the jugular. Perfect. Okay, now I'm going to have you lay down. We're going to work on your abdomen. Okay, I'm going to have you just roll up. There we go. So everything is symmetrical, midline. Her umbilicus is midline. No issues there, no bruising, no lesions. We're going to start by listening to your bowel sounds. Okay, I'm going to listen to your aortic artery. for the bruit. And that's good. Okay, now I'm gonna do a little bit of light palpating, so let me know if anything is tender or sore. Okay, now I'm going to go a little deeper, so make sure you let me know if there's any soreness. Okay, everything was okay with that?
Mm-hmm.
Okay, I'm going to check for your femoral artery, your femoral pulses. That's good. And your lymph nodes. Good. Okay. And then do you do a regular breast exam?
Yep.
Okay. So I'm going to just show you a couple of things. Make sure you're doing these when you do your exam. You should do them at least once a month. Obviously, the earlier that you start, the better, because then you get to know your breasts a lot better. Also, make sure you're doing it in this whichever pattern you choose, whether it's a circular pattern or you can go side to side. That it's the same one every time you do it, and always the same time of the month. But also, you can palpate in your axilla here, and you can see there's lymph nodes in here that you can also notice any lumps or bumps or issues there, so make sure you're doing that as well. And then if you notice any discharge in your nipples, make sure you consult your physician right away. Okay? So her legs are midline, no bruising, no issues there. I've done the reflexes, so now what I'm going to do is I'm going to have you bend your knee all the way up. There you go, and down, and then legs straight up and down, and your ankle, and then forward as much as you can, and then your toes. Okay? So now I'm going to have you resist against my hands, up, okay, and again, and then push on my hands, perfect, and then lift up a little bit, and push down on my hands, perfect. Okay, so now I think what I'm going to have you do is stand up, and I've got a couple more things to check. If this was a male, I would talk to him about a testicular examination, and again, have him do it once a month, same time every month. I would tell him while he's in the shower or as soon as he gets out of the shower, once everything is warmed up and loosened up, he should take his testicles in his hands and roll them around and notice to see if he notices any lumps or anything different, and also any penile discharge, and to consult the physician right away if he does. Okay, Michelle, so now actually, can I have you sit down one more time? I'm sorry. Sit. Or, no, lay down. Sorry. Can you take the heel of this foot and start at your ankle and rub it up to your knee? Perfect. Okay, that's it.
Okay.
Sorry. Okay, so what I'm going to have you do is just walk across the room.
Just normal?
Yep. Okay, turn around and walk back heel toe. Okay, and then turn around and walk on your tiptoes. And then on your heels, coming back. Perfect. Okay, so I'm going to have you come up a little bit further, close your eyes, and I'm going to just, there's the negative Romberg's test. She's good there. Now I'm going to have you, I'll turn here. If you can bend down and touch your toes.
That's fine.
Yeah. Okay. Oh, stay down. Oh, sorry. So I see that her spinous process is good. She's midline. There's no evidence of scoliosis or kyphosis, and she's good there. You can come on up. And do you have any questions for me? No. Okay, I think that's it. I'm going to step out and let you get dressed. Thanks.